How does CORT simulation prepare for cervical cancer radiation? Imagine getting ready for a journey where every step is carefully planned to reach the exact destination. That's what CORT simulation does for cervical cancer radiation therapy. It helps doctors create a precise map of the area to target cancer cells while protecting healthy tissues. During this process, the patient lies on a special table just as they will during treatment, often with immobilization devices like molds or masks to keep them perfectly still. This ensures that the position stays consistent each time, which is crucial because even small shifts can affect treatment accuracy. Next, the patient's body is aligned using room lasers and tiny skin markings called tattoos. These tattoos act as permanent reference points, helping the radiation team position the patient exactly the same way for every session. Proper positioning is vital because it guarantees the radiation hits the tumor and not nearby organs. To further improve accuracy, patients are asked to follow specific bladder and bowel instructions. For example, they might drink a certain amount of water and hold their urine to keep the bladder filled to a consistent level. They are also advised to avoid constipation before simulation. These steps help keep the position of the cervix and surrounding organs stable, reducing unnecessary radiation exposure to healthy tissues like the bladder, rectum, and bowel. Once the patient is set up, a detailed CORT scan of the pelvis is taken. These images provide cross-sectional views that show the exact location of the tumor and nearby organs. Sometimes, additional imaging like magnetic resonance imaging or positron emission tomography scans are used alongside CORT to better visualize the tumor. The images are then uploaded into specialized software where radiation oncologists carefully outline the tumor and organs at risk. This process, called contouring, allows them to design a personalized treatment plan that delivers the right dose of radiation directly to the cancer while sparing normal tissues as much as possible. The simulated setup is not just a one-time thing. During each actual treatment session, the patient is positioned again to match the initial simulation. This is done using lasers, tattoos, and onboard imaging systems that verify the patient's position. If there are any small differences, adjustments are made to ensure the radiation is delivered precisely where it needs to be. In essence, CORT simulation transforms complex anatomy into a detailed, reproducible map that guides targeted radiation therapy. This careful planning improves the accuracy and safety of treatment, which is essential for the best possible outcomes in cervical cancer management. It aligns with medical guidelines that emphasize the importance of imaging and precise patient positioning in radiation therapy. Always remember, each patient's situation is unique, so it's important to work closely with your healthcare team to understand your specific treatment plan.